Uh, Good morning, friends. I am Dr. Anil Bhoraskar. I am a consultant diabetologist and endocrinologist at Raheja Hospital. I am a secretary of Diabetic Association of India, scientific section. I retired as a chair of International Diabetic Federation Southeast Asia region in 2018, and I am attached to three major hospitals including Raheja, Asian Heart and Asian Cancer Hospital. Now, today we are going to discuss about a very common problem which is unfortunately not given the role of priority in the minds of even leading physicians and doctors is sleep apnea or obstructive sleep apnea and its consequences on human health. Why I am saying that we are not really suspecting this in the patients who have multiple medical issues because there is no high index of suspicion. You don't diagnose sleep apnea because you don't suspect. As we see more and more cases coming forward, and as we are increasing our awareness about sleep apnea, and now we have easy diagnostic methods to diagnosis with the help of what is known as apnea hypopnea index. By one single test done at home, we are picking up many cases of obstructive sleep apnea and having given them adequate treatment. Part of the treatment is diet, weight reduction, exercise, breathing exercise, and most important, CPAP machine, which is fixed at night for use of 6 to 8 hours, has changed the complete health scenario of the people who have suffered otherwise many problems, including accelerated hypertension, cardiac arrhythmias, cardiac failures, obesity, high blood sugars, and not only that, but complete distortion of work culture, and economics. The impact of sleep apnea will probably interest you people to know the absenteeism from the work, the chances of accidents and personal injuries, the efficiency in the work of the executives, errors in judgment costing lakhs of rupees to the company are all extremely important that this disorder needs a priority. And the priority will be only given if more and more physicians suspect it in people who are likely to have obstructive sleep apnea. Now, the facts in world, it is estimated that almost 40 to 50% of obese people have sleep apnea. And in prevalence in India, unfortunately, we don't have a good statistical, robust data, but I suspect that every fifth diabetic is likely to have obstructive sleep apnea. And if the diabetic is obese particularly, the chances that to have obstructive sleep apnea is almost 80%. So this is quite a common problem and this needs to be addressed very seriously because the treatment of this disorder is very simple. It's not very elaborate, like formerly thought that people would need to go to an ENT surgeon to get your respiratory passage corrected, get fancy operation or put on some fancy gadgets which have been advertised. The drug can be reduced. One must avoid sedatives and hypnotics and taking alcohol at night. Reduce your caffeine intake. Do a lot of abdominal exercise, yoga, pranayam, weight reduction, and control of diabetes. One of the reasons why I try to treat this condition in my patients with the gadgets is the accelerated hypertension. If a person on 3 or 4 OPD visits find that the blood pressure is just not coming under control, in spite of 4 or 5 drugs, one should suspect that he could be having obstructive sleep apnea, because 80 to 90% of obstructive sleep apnea patients have accelerated uncontrolled hypertension. And that is the reason we have to suspect it in any person who is not responding to your antihypertensive treatment. Now, consequences of sleep apnea: traffic accidents, occupational risk, wellness at the work, particularly person who are handling intricate machinery, health related risk, obesity, cardiovascular disease and type 2 diabetes. Other consequences are very important. I quote here American NHTSA, which is an accident registry of United States, conservatively estimates 1 lakh crashes per year. 1 lakh crashes are due to drowsy driving, leading to 71,000 injuries and 1,500 deaths due to obstructive sleep apnea. The person has an obstructive sleep apnea, he dozes on the wheel and meets with an accident. Sleep deprivation categorically has been blamed for major accidents at work, including Chernobyl, Exxon Valdez oil spill and Challenger shuttle disaster. So it has a great significance economically. Second thing, in our country, there is unfortunately no data. But I feel, like in USA, it is said that more number of deaths take place due to sleep apnea related somnolence on the wheel than alcohol. More number of truck accidents take place because of the driver just go to sleep, because they don't catch up good sleep during the sleeping hours, or they may do overtime and they doze off on wheel and meet with an accident. First of all, there is fantastic improvement in the CPAP machine. CPAP machines is a continuous positive pressure breathing device which throws oxygen, which throws atmospheric air at a particular pressure to overcome the resistance of collapse of the respiratory passage. Now these are all auto adjusted, because many times the pressure required to deliver oxygen in the inner aspect of the lung, inner part of the lung, can vary, and sometimes you can give more pressure which may be harmful, can cause damage. So you need to deliver exact amount of pressure, which is a self-adjusted device. Depending on what is the obstruction, it changes the gradient at which the pressure is delivered. We set it at say 4.5, it goes up to 17, but you need not have 17 in all the patients all the time. Sometimes the pressure is required low. So these auto-adjusting new machines, and they are coming with a very small size, you can travel, and they are airline compliant. That's very important. The compliance certificate is available with all these latest machines. That look here, this gentleman needs to put this machine on long haul flight. He should be allowed to carry it. Now there are battery operated machines. Sometimes carrying battery package becomes a big deal on board, but you have a certificate stating that you need it, particularly long distance flight, you need to put a sleep apnea machine. So these machines which are now available are of a size of a mobile phone. Very convenient, not more than 1 kilo weight, and are allowed at all airports as a security. You don't have to deposit it in it, and most important, airlines allow them to even have a socket to fit their electrical supply.